Hi everyone, my name is Christine Chandran, and I'm a rising senior at the University of Pittsburgh. I'm majoring in the natural sciences with a certificate in global health studies. This past summer, I had the privilege of taking part in Pitt's Comparative Global Healthcare program in Graz, which is a 1-month-long study abroad experience based in Austria and Slovenia. Throughout this video, I'll be taking you guys along with my peers and I as we take classes relating to Austrian and Slovenian history and healthcare, as well as the history of the U.S. healthcare system in comparison. We were able to hear from local professors as well as meet several students abroad. And when we weren't in class, we spent much of our time exploring the cities that we were in, as well as taking field trips to important healthcare facilities, for which you will see. Starting off, we could see an example of an early hospital located in Salzburg, predating Florence Nightingale's time period. It's really interesting to see the similarities and differences of hospitals as time progresses. Understanding the evolution of healthcare practices in Austria requires a journey back in time. During the Elizabethan era, healthcare was deeply intertwined with religion. Monasteries played a crucial role in providing medical care. These religious institutions were among the first to establish hospitals, which were more like infirmaries where monks and nuns cared for the sick. As time progressed, the secularization of healthcare began and the focus shifted towards scientific approaches and medical advancements. The 19th century saw the establishment of more structured hospitals influenced by the advancements in medical knowledge and practices. The incorporation of hygiene practices, surgical innovations, and the professionalization of medical staff transformed healthcare in Austria. Today, Austria boasts a robust healthcare system that's a blend of public and private services. The country has a high number of hospital beds per capita and a well-established network of healthcare facilities. As we could see, the emphasis is not just on preventative care and early detection, but also comprehensive treatment plans that ensures that every single Austrian is able to receive high-quality care throughout their lives. Slovenia, although smaller in size, also has a healthcare system that's based on universal coverage. Slovenia's system is funded through compulsory health insurance, which is also similar to Austria. The emphasis on preventative care, along with a strong primary healthcare network, ensures that healthcare is accessible and comprehensive. We suited up to visit one of Slovenia's major hospitals located in Maribor. There, they provide all sorts of treatment for all kinds of patients under one roof using the latest technology and attentive healthcare workers. As we were touring our respective hospitals and clinics, it was really nice to hear from some of the healthcare workers taking us around. Not only did we get to learn about the place that we were in, but we also learned about their personal experiences, including their schedules and their path to becoming their role in healthcare. Physical therapy in Austria and Slovenia are established in both countries, offering high-quality care and services. In both of these countries, physical therapy is an integral part of the healthcare system and accessible through public health insurance, with a strong emphasis on rehabilitation and preventative care. The profession is highly regulated and ensures that practitioners are well-trained and meet the rigorous standards required for one-on-one patient care. In Austria, the care for disabled children is built on the foundation of integrating education and medical care. This dual focus ensures that children receive the necessary medical treatments while also having access to quality education tailored to their individual needs. We visited an example of this where we went through the learning environments while also seeing the various sensory rooms provided for the comfort of the children. Occupational therapy plays a crucial role in the development and integration of disabled children. This therapy focuses on enhancing the children's ability to perform daily activities and improving their functional independence. As you can see, we had so much fun playing around as well as understanding how these kids are supported throughout their care. The bright paintings and non-intimidating rooms brought us a lot of comfort. Each room had its own specialty, catering to the variety of needs for the different children. Not to mention, I was also impressed with their repurposing of old wheelchairs and bikes for a unique mode of transportation, as you can see in this clip here. I briefly wanted to touch upon emergency services, as the Red Cross has a huge presence within Austria, comprising 90% of all ambulances. And now we move on to the care for the elderly. As people age, the need for specialized care and support becomes increasingly important. In Austria, the well-being of the elderly is a top priority, with a comprehensive system in place to ensure that they receive the care that they deserve. This includes a range of services from in-home care to well-managed nursing homes, as you can see in here. For those who are uninsured, we have something called Mirambulance, which relies heavily on the dedication of volunteer healthcare professionals, and free clinics. These are all funded through a combination of private donations, grants, and support from charitable organizations. Now, the practice of medicine would be incomplete without pharmaceutical services. We also had the opportunity of visiting some of Austria and Slovenia's oldest pharmacies, learning about how pharmacists provided drugs during that time and how the practices have evolved over time. As science advanced, so too did the role of pharmacies in Austria. The 19th and 20th centuries saw significant developments in the pharmaceutical industry with the introduction of synthetic medicines and stricter regulations to ensure safety and efficacy. Austrian pharmacies became highly regulated, with pharmacists required to undergo extensive education and training. This modernization ensured pharmacies continuing to be a reliable source of healthcare advice and medication. Throughout history, medicine wasn't just limited to what was produced in the lab. We also learned about botanical and plant-based medicine. Overall, I was really impressed with how nature was used in medicinal practices, not just the plants but also the animals. We got to spend some time with some therapy bunnies, as well as learn about the use of horses in occupational therapy. On farms, animals play a crucial role, not just in medicine, but also in agriculture, which in the end contributes to medicine. Now, for those of you who are scared, beware. We also got to visit a bee farm in Slovenia, learning about the production of honey and how that contributes to the environment. I personally really enjoyed sampling all of the different treats that they had there. Now, healthcare doesn't only have to do with the direct clinical practices and the distribution of drugs, but it also relates to the social well-being of all civilians. In the heart of Austria lies a beacon of hope for the homeless population, Winzedorf, which is a village designed to offer a sense of belonging and stability to those who have fallen on hard times. There, members are provided with shelter, food, medical care, community, social support, and employment. Hearing stories of residents offers a different perspective and understanding of how to care for the homeless population. Overall, I truly enjoyed the process of learning, especially as we were in different settings compared to our homes. It was neat to check out the different styles of learning that's used in other countries, and there's so many ideas that we could bring back home. Of course, our month-long experience wasn't all just in the classroom and learning. We also got to tour around these cities and really immerse ourselves in the culture. From exploring the historic streets of Vienna and Graz to wandering through the charming towns of Ljubljana and Bled, and so much more, I engaged deeply with the local traditions, the art, and especially the cuisine. I also got to live out my Sound of Music dreams, dancing up on the Alps, and traversing through the various botanical gardens and different castles. Visiting museums and attending different festivities and interacting with the residents allowed me to gain a profound appreciation for the vibrant heritage of both countries, making my time abroad a truly enriching cultural experience. Studying abroad is truly a life-changing experience, and my time in Austria and Slovenia was no exception. These two countries were rich in history and culture and provided such a unique backdrop for studying global healthcare systems. I'm grateful for all the time I spent there, and I'm looking forward to utilizing all that I've learned and incorporate it into my future career and other aspects of my life. For now, thank you all for watching. Danke!